So I'm Melissa Palmer. This is Hannah. Hannah is currently 3.5 years old and not in school. She's at home. And this is Grace. Grace is 8 and she's in grade 2. It was a crazy day. And I woke up with a sense that something was wrong. So my first question to my husband was, did you take the dog for a walk and what is it like outside? And he said, I was walking through one direction dry, coming back wet. So the water, when it came quickly. And it was early. We sent some, I know the kids would have been to school by 20 to 9, and I think it was by quarter after or 9:30 the call was coming in that they had to evacuate the school. So downtown was kind of left open. Nobody really knew what was happening, and when they did, it was, you have to get everybody out. Some people got out, some people didn't. I got word, I think I was on the computer and had seen somebody post that we had been evacuated, and I can remember posting a question like, the whole town's been evacuated? And everything went off. So we lost our power, we lost everything at that point without the ability to kind of see what was going on. So I think it was probably around 11 o'clock. I said to the girls, we need to see what's happening. And as we went around the corner and down the hill, you could see just this mass of humanity working frantically at the bottom of our road. And where did we get? About 3/4 of the way down. And it was just water. And we watched a man cross the road chest deep in water. I got frozen there till Grace kind of tugged on me and said, I don't want to be here anymore. But people were trying to get sub pumps going. You had people moving vehicles up the hill. Like, it was just crazy. And it was at that point I knew I was going to have to pack up the girls and leave. So I got some back to the house and I said to the girls, I'll give you something to eat while I figure out what we need to do. So I went quietly crazy downstairs. I can remember standing in the basement literally going, I don't even know how to do this. This is not my job. I had a moment, I'm sure, where I was visible to the kids where I remember just thinking, I don't know that I can do this. Between packing up the dog and the kids and the stuff and trying to cover everything off, it was quite a scary and profound moment. But we got there, but I had to make a decision to leave the cat. I didn't have enough time or enough room to pile the dog and the cat in the car. So that was quite emotional. And we left. And I can remember Grace saying to me, are we coming back tonight? And I said, I have absolutely no idea, but we're heading to Grandma's. So we went to my mom's in Okotoks.
I'm Julie Drolet, an associate professor in the Faculty of Social Work at the University of Calgary in Edmonton, and a recipient of a CREO Population Resiliency Grant funded by Alberta Innovates Health Solutions. The Alberta Resilient Communities, or ARC research program, is a 3-year funded initiative. It brings together researchers, practitioners, and non-governmental organizations, as well as government stakeholders, to improve understanding of post-disaster services and programs here in Alberta. We feel that this program of research really is a great opportunity to bring together children and youth, their families, and the community influencers who are all there to really support them in their journey in the post-flood context in southern Alberta. And there's a real need to develop our understanding of their experiences, and we feel that we really need to ask them because they know best. In this program of research, I'm collaborating with Dr. Robin Cox of Royal Roads University and Dr. Carolyn McDonald-Harker of Mount Royal University. And in addition to those 2 co-leads, we have 23 collaborative research members and knowledge end users and 29 partners. And so really the focus of this program of research has a collaborative research initiative, was designed right from its onset, where we saw the need for this kind of research take place in the community among those various stakeholder groups. The co-leads in the research program all have prior disaster-related research experience. Robin Cox has a research program focusing specifically on youth, ages 13 to 22. And Carolyn McDonald-Harker has been conducting research with children and their families in the High River area. And we all come from different disciplinary backgrounds. And so I think that convergence of multiple disciplines is a real strength to our research program.
My name's Robin, and I'm a professor at the Faculty of Social and Applied Sciences at Royal Roads University in Victoria. Children and youth are particularly affected by disasters, both because of their dependence on adults and also because of the factors that are associated with their developmental stages and ages. We also know that children are resilient and can act as catalysts of change in their families and communities, and can really be the conduits of information that can support resilience if they're given an opportunity. We're really wanting to work with youth in our portion of the project as partners. That means that we want them to be co-researchers with us. We want to provide them some training in order to be able to do that. We want to develop their capacities as leaders, and then we want to involve them in a social innovation lab process. Really, the heart of social innovation is collaboration, creative and shared learning. We want to integrate into that social innovation lab some other novel methodologies that we know youth are already using in their lives. Arts-based methods, nature-based methods, the use of new and upcoming technology, all with a focus on innovating resilience solutions that they can then prototype and use in their communities and test, see how they work, and then share the best of those with other peers in their community and outside with other communities. We really see this as an opportunity to use and work with youth as multipliers of knowledge and resilience innovation.
My name is Dr. Carolyn McDonald-Harker, and I am a sociologist and a professor in the Department of Sociology and Anthropology in the Faculty of Arts at Mount Royal University. Population resiliency, in its simplest of terms, refers to the ability of individuals and communities to overcome, to adapt, to cope with, or to bounce back, if you will, from difficult and challenging circumstances or events. We know from the disaster literature that disasters such as the 2013 Southern Alberta flood can impact children's health and well-being in multiple ways, resulting in perhaps heightened anxiety or social withdrawal behaviors, as well as poor school performance, and even a disinterest in participating in recreational activities. And so my research study specifically looks at what are the factors that lead to some children being more vulnerable in their response to a disaster like the Southern Alberta flood, as well as, on the other hand, why are some children more resilient? So what is it about those children? What strategies have they adopted or have been provided to them that enable them to be more resilient? And then knowing what those resiliency strategies are, we are then able to take that information and enable others who may not otherwise be resilient to become more resilient, to be able to better cope with, recover from, and overcome difficult circumstances in their lives.
Well, I'm hoping on a very personal level that this town stays dry, that we never have to do this again. It's nice to have all these ideas in place and everything, but I really hope we never have to do it again. That would be the biggest one. I think beyond that, though, really just to come out of it whole human beings. We've dealt with, I think, mostly with Grace's anxiety and some of the things that she's experienced, and I think Dad and I are calmer, and we're trying to find our equilibrium again. My hope is just that we come out of it. Personally and as a town, we just come out of it and are able to hold our heads up and say, it was crappy, but we did it, and here we are, and and help going forward where we can with information, so that people can move on.